Aleksic does this type of procedure every second Monday at the Life Peninsula Eye Hospital in Claremont. That's where the actual machine is. Closer to the time, usually the Thursday before the Monday, you will receive an email from our rooms stating exactly what time you need to be there. Say, example, you need to be there at 9 for your surgery to take place at 9:30, and you'll be able to leave the clinic at 10:30. So on the morning of the surgery, you are allowed to eat normally. You don't have to be nil per mouth or anything like that. If you are taking any medications, you can continue to take them as per normal. We ask patients to dress comfortably in their own clothes, dress slightly warmer than usual because we don't want you to feel cold in the theatre. When you get to the front of the hospital, your name will be on Dr. Aleksic's list. The receptionist at the hospital will offer you to take what we call a small chill pill. It's called Ativan. It's not going to knock you out completely. It's just going to literally take the edge off things, because in general, when anyone goes for eye surgery, you feel a little bit stressed. So once they prepared everything, Dr. Aleksic checks the machine before each and every patient. He himself will punch in your numbers into the machine. Once they are ready, they'll ask you to come through. You lie on a flat bed with your head in a little ring-like structure like this. You will look into a set of lights, and you will feel as if you are lying on the pitch in Greenpoint Stadium, and you are looking up. Everybody left, but they left the lights on. So what you will see is this ring of yellow lights with a black sky full of red and green stars. Now, I'm first going to explain the actual Lasik procedure, and then I'll go over to explain the PRK procedure. Up until now, exactly the same. You don't have to worry about any needles or anything coming close to the eye. It's a painless procedure. What you will feel at one point is as if someone is doing this, just a bit of pressure on the eye. So that is when Dr. Aleksic marks the eye. You don't also have to worry about keeping your eye open all the time. Doctor uses what we call a speculum. It's like a little clamp to keep the eye open. So we'll start on the right side. He'll cover the eye that's not being operated on. He'll clean the whole eye area. No need to wear makeup that day because we're going to take off anyhow. What he will then do is he'll clean and disinfect the whole eye area. He'll put local anesthetic drops in. The doctor talks you through the whole procedure. He's going to say to you, I'm going to touch your upper lid now, and then he touches the upper lid. So what you will need to know is when he starts, what he will ask, what you will then feel is that bit of pressure that I was referring to. That's when he marks the eye. Why does he need to mark the eye? Because when he creates that flap, and he flaps it open, he wants to, when he puts it back, be able to make 100% sure that he puts it back exactly the way he found it. The doctor will instruct you, please look towards the red light. That is your tracking mechanism, or that is the machine's tracking mechanism. Now the machine will track your eye more than 1,000 times per second. That's a safety mechanism, because as soon as you are looking in the direction just slightly off, the machine will switch off and the laser won't take place. So that's quite reassuring. Then what you will hear is this tick, 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 almost tractor-like sound. Now that's Dr. Aleksic with his microkeratome. He uses a microkeratome to create the flap. Now when he creates the flap, what you will feel is everything goes black. You'll open the flap, he creates a hinge, so he doesn't cut it straight through, he leaves a hinge behind and he'll open it. Now just a side note, when Dr. Aleksic cuts the flap, and that's the only way he can determine what your corneal tissue is actually like. We can't determine it prior to surgery with a test or a machine or anything like that. When he cuts this flap and he looks at your tissue and is not happy with the way your tissue behaves, what he will then do, he will not proceed with the procedure. He'll put the flap back, put some drops in, we'll wait for it to heal, and then 6 to 8 weeks later, we can approach it in a different way. What I mean is we refer to PRK there. Okay, so now your tissue is perfectly normal. He created the flap. The laser itself takes a few seconds depending on your prescription, and that's when you will see nothing for a few seconds. You will smell a gas. It's not your eye that you are smelling, it's a gas from the machine. Once he's done, he'll clean that area, he'll put the flap back exactly the way he found it, and then he'll put an antibiotic drop in, anti-inflammatory drop in. You'll close your eye, put a clear shield over it, and tape it to your face. What he will then do is he'll go over onto the left eye, and he'll do exactly the same procedure, but he will again tell you, I'm going to touch your upper lid, I'm going to touch your lower lid, you'll hear a sound now, please look at the green light. And that's just for you to not get any surprises, and it makes you feel a bit more calm. Once he's done with both eyes, the procedure takes about 30-35 minutes. You'll have two shields on, like this, but you'll be able to see through them. He'll ask you to look at say for example, a clock on the other side of the wall. It won't be as clear as you can see right now with your glasses or contact lenses, but it won't be as unclear as when you now take your glasses or contact lenses off. So what he'll instruct you to do next is you receive a bag with 3 sets of drops: an antibiotic, an anti-inflammatory, and a lubricant. The lubricant you can use as much as you like. When you get home, we're going to ask you to put your drops in, and the best thing then to do is to take a 2-3 hour nap if you can. That will reduce the amount of scratchiness, and it will actually speed up the healing process. The remainder of the day, you'll put your drops in every 2 hours until you go to bed. The following day, you'll come for your follow-up appointment. That's for doctor to make sure that the flap is regular, that there's no signs of an infection, and that your vision is starting to improve.